If a girl engages in frequent and unprotected sexual activity at a young age, especially during adolescence, when her reproductive system is still developing, it can have serious short-term and long-term medical, emotional, and reproductive consequences. Medically, young girls are more vulnerable to sexually transmitted infections such as chlamydia, gonorrhea, HPV, and HIV, especially when protection like condoms is not used. These infections, if left untreated, can lead to pelvic inflammatory disease, which damages the fallopian tubes and uterus, often resulting in chronic pelvic pain, ectopic pregnancies, miscarriages, or even permanent infertility. Since a teenager's cervix and vaginal tissues are still maturing, repeated exposure to penetration and physical stress may cause micro tears and inflammation, reducing vaginal elasticity and increasing vulnerability to injury and internal trauma. Frequent sex at this stage without proper care may also cause hormonal disruptions that interfere with ovulation and menstrual health, which are crucial for future pregnancy. Furthermore, if early sexual activity leads to pregnancy, girls under the age of 18 face much higher risks of pregnancy-related complications such as anemia, high blood pressure, premature birth, low birth, weight babies, obstructed labor, and in some cases, maternal death. Due to their bodies not being fully prepared for childbirth, emotional and psychological impacts are equally severe. Girls who engage in early sexual activity, especially if it's not consensual or emotionally mature, are more likely to suffer from guilt, anxiety, depression, emotional trauma, trust issues, and even post-traumatic stress. These effects can disrupt their mental well-being and affect their ability to build healthy relationships in the future. Moreover, young girls who become sexually active or pregnant often face social stigma, are forced to drop out of school, lose access to education and career opportunities, and can be trapped in cycles of poverty and dependence, especially in cultures where early marriage is common. Without access to sex education, contraceptives, or adolescent-friendly medical services, many of these girls are left unaware of the risks or unable to protect themselves, which only increases the likelihood of repeated pregnancies, unsafe abortions, and long-term reproductive damage. Repeated childbirth at a young age also weakens the uterus and pelvic muscles, increasing the risk of uterine prolapse and complications during later pregnancies. Socially and legally, early sexual exposure in minors is often the result of power imbalance, coercion, or misinformation, making it not just a health issue, but also a human rights concern. According to WHO and other health organizations, preventing such outcomes requires comprehensive sex education, availability of birth control, regular STI screenings, emotional counseling, and legal protections that delay early marriage and empower young girls to make informed decisions about their bodies. In conclusion, while a girl who has had frequent sex at a young age can still become a mother later in life, if her health is intact, the risks to her fertility, mental health, and overall well-being are significantly increased if she is not provided with education, protection, and healthcare support during those early years. Hence, this is not just a personal matter but a medical, social, and moral responsibility that involves families, schools, healthcare systems, and governments to ensure the safe physical and emotional development of every young girl.